Good afternoon, and welcome to Addressing Your Number One Security Risk, Data Privacy and Data Encryption, a complimentary webinar from HealthSystemCIO.com, sponsored by Proofpoint. My name is Anthony Guerra. I'm the Editor-in-Chief of the publication, and I'll be your moderator today. We encourage you to ask questions. Please feel free to type them into Q&A box in the lower right-hand corner of your screen, and leave the default set to all panelists. You can put those in at any time, like I said, and we will pose them later in the program. Download the deck. You can use the URL in front of you. There's a shortened URL at the bottom of every slide, and I will also send it out in the chat box, so plenty of chances to get a hold of the slide deck. We will have an archive available of this event, which will be ready within a business day or so, and you'll receive an email when it is ready. Separate registration is required. Just to give you an idea how we're going to spend our time today, we're going to go about 45 minutes. First, we're going to hear from Wes Wright, SVP and CIO at Seattle Children's Hospital. Then we're going to hear from our sponsor, represented by Patrick Wheeler, Director of Product Marketing with Proofpoint. And then we'll do our Q&A with Wes. So without further delay, I'm going to turn it over to our good friend, Wes Wright. Wes?
Good morning, Anthony. Morning for me. I'm on the opposite coast, what I like to think of as the good coast, from where you're at. So I appreciate you inviting me to speak today. I like to start my presentations with this particular slide because I think it's pretty unique in our industry, and that is the bottom line, that we'll prevent, treat, and eliminate pediatric disease. So essentially, our mission statement at Seattle Children's, in Seattle Children's we have the hospital, the research institute, and foundation. So the research institute is in charge of eliminating pediatric disease, and essentially we want to put ourselves out of business, which is kind of a unique mission statement for an organization. So I like to start all my presentations with that. So a little about me. I joined Seattle Children's in 2008 as the Vice President and Chief Technology Officer. At that time, I came up with Drexter Ford. He was the Chief Information Officer. He left a couple years ago. I moved into the CIO role. Prior to that, I was working down in San Diego at Scripps Health for that IDN as the Deputy CIO down there, and prior to that, I served 20 years in the United States Air Force. The last 15 or so, kind of pretty much doing what I'm doing now, but at Air Force hospitals instead of civilian hospitals. And yes, I went to college. I like to put that in my slides too, because some of the times, by the time I get to the end of the deck, you may actually be wondering if that were the case or not, but I assure you I did go to college. So I can't start any discussion on security, on virtualization, on anything that we do in IS without this framing slide. This is S5. It's our philosophy within information services at Seattle Children's, both at the Research Institute and at Seattle Children's Hospital. Everything we do revolves around safety, so that's at the apex of this. I guess we call it, it's not an octagon really. I don't know what shape that is. Terahedron? I don't know, I just made that up. Everything points to safety at Seattle Children's. Now, the IS participation in safety, we kind of boiled it down to three things. That's stability of our applications. As everybody moves more and more of the information into an electronic medical record, a document management system, a cardiology system, a PAC system, whatever system it may be, stability becomes more and more key to patient safety, really. After stability, we recognize that speed was a big contributor to safety. You might wonder why that is, but it's because if you have all that information in the system, it does nobody any good if the nurses and doctors don't access that system. And they won't access that system if it takes them 2-3 minutes to log on and get to that information. So stability and speed. And then finally, security. That's kind of germane to what we're talking about. Not kind of germane, it is germane to what we're talking about this morning, for me, afternoon for some of y'all, is security. I can keep the systems stable, I can keep them speedy, but if our patients and families don't think that their information is secure, they're going to be more than a little reticent about providing the type of information we need to provide them the best clinical care that we can. And then the underpinning how you get to stability, speed, and security is, we think, is through simplicity. The simpler you can make your systems, the faster you can make them, the more stable you can make them, and really, the more secure you can make them. And that kind of seems counterintuitive, but it's not. If your systems are built on a simple platform, you can tell when something is not behaving correctly, and then you can investigate that and potentially counter any security issues you might have. And speaking of security and data security in particular, I've had this discussion when Anthony asked me to do this presentation. I had a discussion with some of my CIO peers and asked them what security meant to them. And two themes really came up. There's insecurity, and that's the privacy aspect of it, and then control. A lot of people confuse control with security. So control by itself, they're calling that security, and it's not really. And I'll get into that further on in the discussion. And then privacy. And within privacy, there's really two aspects of privacy. One is some type of role-based access that's ensuring that the right people can only see the data that they're supposed to see. And I guess maybe a sub-bullet to privacy would be encryption. Or you could actually maybe sub-bullet that to the access part too, because that's really what encryption does, is make sure only the right people, the people with the keys, can see the data that's in there. So that's the way I think of privacy. And then we move down into control. And control is, and I realize I'm drawing a fine line here, but control is how you keep the data from moving to places. I guess maybe that's a good way to think of it, is the data movement. How you keep the data from moving from the correct place to perhaps the incorrect place. And of course, we all know to do that via our network topology, both the physical and the logical topology. And then a newer way to think about control, and that's keeping the data where you want to keep the data, is through virtualization, which we're at Seattle Children's, we're kind of a little bit known for the virtualization stuff that we've had going on from a virtual desktop environment for about the last 4 or 5 years, and I'll get into that. So in control, you have application and desktop virtualization. To me, this is really the key to control. So when you virtualize your applications, you keep your data in the data center. So you never, one, you keep them in the data center. Two, you keep them in a known location in the data center. So three, then you can explicitly control what is accessing those crown jewels of the data. So, for instance, for us, our EMR is Cerner, so we have our Cerner database. We know that anything that accesses that Cerner database completely has to come from one of our Citrix XenApp servers. There's no other way we've designed our network to where there is no other way that database gets accessed except through one of the either application servers that sits there with a database, the Cerner application, or the XenApp server, which runs the client application. So we have control of the ingress and egress to that database. What this also helps us with, it helps us keep the data behind that one firewall, assures the egress and ingress, and then on top of that, we've installed our virtual desktop. So what that allows us to do is make sure that the only desktop that is accessing the application, the XenApp server, that is the only thing that can access the database, is controlled by us as well, and we can lock that down to where it can only do certain things, and that helps us with our logging of what data is moving where, and then we have the bugaboo of DLP, data leakage, data loss prevention, that we all struggle with, from both an email and an endpoint encryption piece, and I think it's worth some time to talk about the endpoint encryption right now. When Anthony asked me to do this talk, I took a look on the web at all the breaches and things that are going on, and by and far, most of the breaches that are occurring in healthcare right now are because of loss or theft of endpoint devices. So even though we have everything logically separated or virtually separated at Seattle Children's, we still made the decision to do endpoint encryption. Easy decision on the laptops. That's a no-brainer. We're using a mixture of Guardian Edge and BitLocker on that. But we also made the decision that any USB device that you plug in and move data to, that particular data move would be encrypted. So when you stand up an endpoint thumb drive, let's call it a thumb drive encryption program, that's one of the decisions you have to make, is when somebody plugs a thumb drive in, am I going to encrypt the entire thumb drive, or am I going to encrypt any file that is moved onto that thumb drive? We made the decision of B, and I have a whole separate presentation that I do on the pain and angst that goes along with that type of endpoint encryption. It is important to get your endpoint devices, and I'll throw phones in here now. It is important to get those encrypted, because essentially HIPAA and the HITECH Act is telling us that encryption is essentially your get-out-of-jail-free card. So sure, if you lose an endpoint device, a thumb drive, a laptop, a phone, if you can say that and verify and show that that device was encrypted, you're in a much better position than otherwise. That's not to say that you don't have to worry about your data in motion. I've kind of addressed the data at rest point here already with the way we virtualize and segment. But the data in motion is a big one as well, and I think we'll start getting a lot more focus from our OCR brethren out there. We use two tools. Guardian Edge is what we use for our endpoint and thumb drive encryption right now. And then for our data in motion, we use, wherever we can, we try and stand up a TLS, transport layer security with our email. The top 50% of the folks that we do clinical business with via email. So we'll use that to encrypt the pipe, but secondarily to that, we use Proofpoint to send securely. So within our Outlook client, we have a button right above the send button that says send securely. So our folks that want to send, although we tell them not to, of course, but that want to send some type of Privacy Act information to a peer or a counterpart, they simply, instead of hitting the send button, they hit the send securely button, and it runs through the Proofpoint security suite. Something that's come up quite a bit recently is the mobile device encryption. Now, this is kind of where I'll say some stuff that maybe some of y'all won't agree with. I actually don't think that there's a real need out there for the mobile device encryption suites that folks are selling right now. I think it's what one of my old bosses would call a self-licking ice cream cone. That is, the MDM manufacturers or sellers have created the market so that they can sell into that market. Whenever I have somebody send me something that says sent via good or something like that, it makes my jaw clench, because I know that person is paying X amount of money to encrypt email that could be encrypted anyhow. Just to re-reference the get out of jail free card, if you stand back and look at it, through the we use Exchange here like most people do, but through the Microsoft Sync product, you can force encryption, you can remote wipe a device, and you can force a PIN. And that's all for free. The argument I've heard is that, yeah, I can do that, but I want to have my email encrypted in a separate container. I want to have it encrypted on top of the mobile device encryption. And I guess that's well and good if you want to pay $10 a client or however much it is. But at Seattle Children's, we took a look at it and saw that the better percentage of our folks were using iOS devices, and then secondary to that was Android, and then because of my location, Windows device was actually approached the number of Android devices we had. So since the Android devices and the Windows devices are easily encryptable and controllable, well, they're easily encrypted because they're controlled by Apple and Microsoft, and so we're not interfering with a whole bunch of programs that we don't know how they run. We decided that, yeah, we'll force encryption on the iOS and the Windows devices, but we're going to leave the Android devices alone. At the time we made this decision, I was carrying an Android device, and a couple of folks in my department were carrying an Android device, and when we tried to force encryption on those devices, it pretty much blew the device up. So it's a risk-based decision that we made on that mobile device encryption strategy. And I think it's one that more and more facilities should look at rather than just paying for that solution. So as I mentioned before, we've got control and privacy, and the most the most effective measures from a control perspective that help me sleep are one, that whole virtualization strategy from the client to the application to the database. Of course, the database is not virtualized, although we could, but the database isn't virtualized, but everything else is virtualized to get to that, and I know that that is the only way that somebody can get to that data. So that helps me sleep well at night. And from a remote perspective, I can give a VDI I can give a virtual desktop to anybody anywhere in the world, China, for example. But like I said, that's one of the keys in that three-step virtualization process. And so if somebody is trying to get a desktop, and by the way, that's the only way we let them access corporate resources is through a virtual desktop. If they're not on our network, then they have to have two-factor authentication to get to that virtual desktop. We started out using a USB fob type. It looked like a thumb drive, and then we went to the kind of the RSA digital reader thing, and now most all two-factor vendors have the soft key based two-factor authentication. But from a control perspective, those two things are what help me sleep best at night. And then from the privacy perspective, encryption does help me sleep better when I'm encrypting an entire laptop device, or when I'm encrypting any data that moves onto a USB device. I've already spent too much time talking about my philosophy on encrypting or not encrypting phones. And then in email, I sleep better at night because we have a policy that says don't send email or don't send PHI through email. No, that's not true. That doesn't help me sleep better at all. Because people will use the easiest method they can to get information to who they need to get it to. But my DLP watching that email gives me a slightly better chance at sleep. And then using Proofpoint and our Send Secure button and transport layer security, so I know that even if they are using email, and I guess I'm talking out of two sides of my mouth there. I say, don't send PHI via email, but give them a tool that if you're going to send PHI via email, I would like for you to send it securely. So I can see I'm not being on the straight and narrow on that one. But if you're going to do it anyhow, I would rather you hit the Send Secure button and make sure that email is protected in transit and then protected at the recipient. So I've kind of reached my time here, and I think I'll turn it over to Anthony now to lead us into the next section.
Very good, Wes. Well, thank you so much, and I'm looking forward to our Q&A as well. So now I'm going to turn it over to our sponsor, represented by Patrick Wheeler, Director of Product Marketing with Proofpoint. Patrick?
Great, thank you, Anthony. And thank you, Wes. That was really interesting, especially hearing how you're solving the strategic and the tactical challenges of compliance in a very dynamic environment. And I think you really hit on some of the things that we see as the big challenges around encryption, and also some of the solutions that a lot of customers that we find are actually taking on. First of all, it's often very complex. And so the question and I've been even before I was at Proofpoint doing mail security and messaging security. I worked on endpoint security and endpoint encryption for about 7 years. So I have a pretty good view of the complexities of and the challenges of encryption. And one of the things that I find is that encryption in general is very complex. Key management is one of the major obstacles to deploying and managing encryption across all endpoints and all devices. And that often the tools that customers buy, they'll buy encryption as part of a much larger suite. And so they'll get it, encryption that covers all the different devices, mobile, smartphones, tablets, PCs, and then try and deploy mail, and then try and deploy everything together. And it becomes very difficult to manage because a lot of them are not always purpose built or don't integrate the different pieces well. So there's the complexity that's been a major challenge. Inaccuracy is often another challenge because a lot of times, you rely on end users actually having to make decisions about what's considered, sensitive information. If you ask a user to decide, should I encrypt this or shouldn't I? If it's difficult, they will probably not. If you ask them to, decide, to justify, should I send this file to this person? They're going to, they'll, with, for example, DLP, they'll often put in a, explanation saying, yeah, I need to send this. So I think, you get a lot of inconsistency and also sometimes inaccuracy. And then ultimately, users tend to avoid it, because what we find is that people really want to get their job done, and security measures oftentimes tend to seem to end users like an imposition or an obstacle to getting their job done, to accomplishing their objectives. And so what happens as a result is that, a lot of the security solutions, tools, especially around encryption that organizations buy and, with the best of intentions, end up not being deployed precisely because they actually result in a lot more complexity, inaccurate and inconsistent policy, and ultimately end users avoiding them. So I think, as Wes talked about, it's really useful to think about. What we find is that organizations that have success here, like Wes's, tend to think about the data that they're enforcing, and recognize that there are actually really three different main sort of scenarios. There's data in motion, data in use, and data at rest. And so each one has a different sort of layer for monitoring, different tools for monitoring, and different ways for, and even different kinds of data that are actually in transit. So, for example, data in motion typically can be monitored at the network in access, whether it's through email, through web, network-based monitoring, and can be enforced with things like mail encryption, with messaging and mail DLP, social media and DLP archiving. Whereas data in use, when users are actually accessing it, for example, on their smartphone, on their tablet, on their PC, on their laptop, typically, that's where you can monitor. That's where you can monitor for. You need to monitor more at the endpoint, and more importantly, actually handle protection through, for example, endpoint and removable media encryption. Tools like USB thumb drive encryption, PC encryption, laptop encryption. Excuse me. And then finally, there's actually a third dimension that we didn't really talk about too much, and it's sort of this data at rest. So finding that PHI, that PII, wherever it happens to rest. And a lot of times this actually can be done, this is more of a discovery mode where you're actually searching for example, sensitive information in archives on mobiles, databases, remote devices, and is often really driven around content and around archiving and discovery and retention requirements. And so, one of the things we find is that, and Wes talked about this, was that really endpoint encryption can be often tackled, using integrated tools, for example, that are built into the smartphones into the laptops. He uses a combination, he said, of Guardian Edge and BitLocker for his PCs, and then integrated tools for the iOS and Windows devices. And that's a great solution because a lot of times, they have decent tools built in and that simplify a lot of the challenges on the key management side. We find often, and I was actually pleased to hear him mention that he uses Proofpoint because that's really oftentimes a low-hanging fruit when it comes to encryption because so much intellectual property or PHI actually travels over email. And one of the things that really, and so it becomes a really obvious place to take some quick actions for providing protection for your sensitive information, PHI in transit. And I think, Ben, if you can integrate that into your existing mail infrastructure, that's even better. Excuse me again. So ultimately, the ideal solution then really addresses the problems of complexity, of inconsistency, and of users avoidance by actually becoming really easy to set up, really accurate for identifying information, and really transparent. And this goes back really to Wes's comment. He says, if you're going to send PHI, and users are going to do it, do it securely. So make it really easy. Have that send securely button so that users can very easily encrypt information that they want to then send via email, so they don't have to jump through hoops, so it doesn't feel like an imposition. And then, I'll just close with, mentioning that Proofpoint, we are a cloud-based provider of industry-leading solutions for messaging and data security and threat prevention. And with that, I will hand it back to Anthony. Thank you very much.
All right. Well, thank you so much, Patrick. And now we're ready for our Q&A. So as I mentioned, please go ahead and send your question, type it into the Q&A box, and leave the default set to all panelists. So let's get started, Wes. First question, does Seattle Children's have anything that can pick out patterns of ePHI or sensitive info in the event that someone neglects to hit the Send Secure button? And if not, any sense of how often people make that mistake?
Yeah, we do. That's part of our DLP program that we use. We're switching tools. We're right in the middle of switching tools right now. So I don't want to mention who we're using, but yeah, there's a bunch of heuristics that most DLP tools, right out of the box, you can go, okay, here's a HIPAA compliant heuristic that when somebody sends an email, it'll run through that tool, and then the tool will say, depending on how you set it up, your confidence levels, it'll pop back to the user and say, hey, we think that there's some PHI in this message that you're trying to send. Do you still want to send it? Or do you want to encrypt it? Or you can set it up to say, we found that there's some PHI in this information. We're blocking the sending of this information. We don't usually use that second one unless it's got to hit like the 99% confident level that there's PHI in there. And they're really, the users are doing a much better job of policing themselves than they were 5 years ago. So we don't really get very many of the 99% confident that somebody's sending PHI non-securely. But I also think that as our partners, or end users, that's what we call our users, our partners in clinical care, as they're becoming more cognizant and more aware, I guess that's redundant, of the personal healthcare information, they are also becoming bigger and bigger users of the Send Securely button in our Outlook application. So between those two things, I don't think we get a whole lot of email going out unsecurely, and probably in the 5% range.
Very good. This is a question regarding cloud issues, and we do have a specific event coming up in about a month about cloud, so anyone who has specific cloud questions can register for that. But let me ask it to you, Wes, see if you got comments. For a CIO considering an in-house versus cloud-based EMR system, what are the privacy and security concerns of the cloud that you may not necessarily face with an in-house system, if any? Thank you.
I think Wes Wright, personal opinion is that it would be the exact same issues that you would think of if you were to host that EMR in-house. The beauty of the cloud, and I'm a huge cloud proponent. I've told my folks that it'd be really cool if I didn't ever have to buy another server. That's how cloud-centric I am. But I think what the cloud gives you is you have the same requirements for protection of the data. And so your cloud provider, through your BAA, essentially has the same requirements as you do. But the cool thing about that is that instead of having to stand up a solution to meet a requirement. Now, from your seat, you get to dictate that the cloud provider meet that requirement. And any of the cloud providers that are in the healthcare space, I'm pretty confident that their security is probably as good, if not better, than most on-prem hosted folks.
Very good. You talked about, when you talked about some of the security issues that were put in place to deal with things that should not happen because of policies that are in place. But that makes total sense, and we've seen that in some of the work we've done when we talked to folks and did webinars around text messaging. That there's certain things you're not supposed to do, but everyone's doing it. So the CIOs put in place things that deal with that reality. So it made me think of you could tell your teenager they're not allowed to drink, but you also want to tell them if they do drink that you'll pick them up, right? So anyway, what are your thoughts around, a little more thoughts around that?
Yeah, that's that is one of those gut check things, both from a parent perspective and from a CIO perspective, that you kind of have to struggle with, because as I'm telling our partners, no, don't send data via email. But if you're going to, here's a simple, easy tool that I'm putting in place and paying for you to do that. So it feels really sloppy from an integrity perspective. But on the other hand, I think eventually what I'll be able to do is take away that policy that says don't send PHI via email, and instead say if the way to send PHI via email is to use the Send Securely button. So that's, I think I'll be able to do that in the next couple of months, because the awareness is there. Same with, the Dropbox and those kind of things is, until I can put a tool in place, and this is more from a research perspective than it is a clinical perspective, but until I can put something in place for my researchers to use besides Dropbox, then I really can't say don't use Dropbox. Again, they're very intelligent, of course they're intelligent, very cognizant of not putting PHI, and they don't work with very much PHI, unless you count zebrafish genomic data, but I don't think so far we count that as PHI. So, and until I could stand up a solution for them to use, besides Dropbox, I kind of, as much as it hurt me in the guts, I kind of just had to let them keep using it. And now I have stood up a solution for them to use out in the cloud. So I'm back to the original question. I'd love to be able to run my EMR from the cloud. I'm standing up my secondary data center, and if I were just right at the very tail end of it, of making everything work together. But if I were to start it all over again, I would start my secondary data disaster recovery efforts in the cloud and would never look at a physical space.
Very good. Let's talk a little bit about spending in the security area. This is one of those areas, like insurance. You can never have enough insurance. You could probably never spend enough on security, but there's got to be a limit. You have a certain percentage of the organization in terms of your budget, what they're spending. You can get a little piece of that for IT, and then within IT, a little piece of the IT budget is for security. Mm-hmm. And it gets tricky because, like you said, now sometimes you have to put in place spending for things that people shouldn't even be doing. So there's a policy that says you can't do it, but now I've got to spend money. So, I mean, do you ever get in conversations? There's a couple of questions here. One is talk overall about security budgeting. How much does it get? Is there a percentage? Any way to give people some guidance on how to know what they should be spending? And then, have you ever gotten into discussions where someone said, well, why do you need to spend this if people aren't allowed to do this? So can't you get rid of this? But then, we went into the details of why you can't. But anyway, wherever you want to tackle that whole thing, go for it.
Yeah, I've had that question. A couple of years ago, my CEO in an audit and compliance board meeting said, when does the curve become what is that word, asymptotic or something like that? I forget. But when is the juice not worth the squeeze? That's my non-PhD thing right there.
What was it? And the other one was the self-licking ice cream cone?
Right, yeah, you can use any of those.
Okay.
But yeah, I've had my CEO ask, I've had my board ask, when is enough enough? Right now I get about 5% operating budget a year, and of that, probably about 5%, probably about 10% is spent on security. That's operating. Capital is wildly variable from year to year. One of the things, I think one of the hidden costs that we don't get to is how much of regular, and I'm doing air quotes, regular IT folks' time used up in security. So to get to that, I've just recently started a time tracking system to where one of my buckets is security, and that's throughout my whole entire IT operations, so that my folks can tell me how much time they're spending on security specifically. And I think when we start compounding those numbers together and adding them up, I think we're going to find that we spend, this is just a wag on my part, but I really feel that we're going to be somewhere between the 12 and 17% of our time is spent on security or security-related tasks, which I think is going to be pretty eye-opening to a lot of my peers and my boss, the CEO.
Very good. I think we have time to get in one more. What is Seattle Children's doing about medical device security, such as CAT scan, machine ultrasound, that type of thing?
Yeah, that one's a toughie. I personally don't. At Seattle Children's, our biomedical engineering group does not fall under IT, which I think within the next 2 or 3 years it probably will, just because those devices are becoming so operating system and network centric. But I just haven't made a push for it. And so what are we doing for security on those is, back to the logical separation. I can't physically separate them, but I can logically separate them from the rest of my network. So my medical devices are all on a separate network, separate virtual network, one, and then two, one of the things we've done at Seattle Children's that's really kind of unique, I think, to healthcare organizations is we've actually implemented 802.1x throughout our campus, and that's security at the port level, to where somebody can't just plug a device into a port and have it jump onto the network, or at least use the network for transport. So that helps us because then our biomedical engineers have to come to us whenever they put something on the network. They have to come to us for an IP address. So I kind of have that gating factor built in right now. But if you look at, I think it was Ascension Health out of Illinois that the CTO did that 2-year study on that and released it to the public. I think that's our next greatest cause right now, I think, is locking those devices down. So we've done what we can from the basic network security perspective, but I think there's a long way to go, really.
Very good. Yes, that was Essentia, and I recall the article you mentioned. But Wes, that's about all the time we had today. Tremendous presentation, tremendous Q&A, lot for people to think about, so I definitely want to thank you. As I mentioned, folks will receive an email when our archive recording is ready, and a separate registration is required. If you've asked us to communicate to Chime about your CHCIO credits, we'll do that. If not, don't forget to claim your credit. Attending our webinars gets you 1 CEU towards that program for each webinar attended. I want to thank our sponsor very much, and Patrick and with Proofpoint. Questions, comments, please email me. Suggestions for improvements. Always interested in making these programs the best they can be. And you can go to our website to view the upcoming schedule and our last 12 months of archives. So with that, I want to thank everyone again for attending, and everybody have a wonderful day.
Thank you.
Thanks, Anthony.